The data is where it all comes home, showing exactly how you are doing. The question is, how do we all become more like the doctors, our friends in Seattle? Farzad, why don't you tackle that? It's your area of expertise.
It's happening. There is this transformation that really is sweeping across healthcare, where more and more physicians and practices and hospitals have the tools to measure the care they're delivering, to be able to monitor it, but not just that, to actually be able to improve it, to tackle it, to have tools that remind them, that help them deliver the right care at the right time for the right patient. What's also amazing, though, is that we're also seeing at the same time health plans, including Medicare and Medicaid, increasingly rewarding that so that doctors don't go broke if they spend more time and effort helping someone stay healthy.
Let me ask you a quick question. You mentioned your mom was getting care at a transition point, the doctor didn't have her data. How did you broach that topic to the doctor?
You know, it's uncomfortable. We have to admit that. Right now in our healthcare system, if the patient says to the provider, can I have a copy of my medical record? There's not that message out there that it's okay to ask for your own medical record. And I think that's a very important message that people need to have, that not only is it their legal right to get access to their own information, it's also the right thing to do. It helps you take better care of yourself and your health care.
Risa, talk about that, because we're asking folks, consumers, to be brave, to be smart patients.
Well, you know, we see this culture changing in healthcare. It is becoming a culture that is more focused on improving the quality of care, and that means everyone getting engaged. But it's still, in some ways, early days. And we know that the places that are making the biggest strides, the fastest strides, are ones where they're able to focus on delivering patient-centered care because they have patients involved, people telling them how to make the system better and how to help them make the system better themselves. So I think this culture is changing, but it really requires consumers to be more involved than they've been.
And I think we're onto something here. The transformation in healthcare is happening. And the consumers that we're talking to right now need to be involved in this movement. Let's hear how one woman stepped up and took control of her health. Shanda's joining us from Michigan. How are you, Shanda?
Hi, Dr. Oz. I'm Shanda Reardon. I'm a wife and a mother, and I'm working to improve my health. Diabetes has taken a terrible toll on my family. I have an aunt and a grandfather who died of complications from diabetes. I have another aunt who has diabetes, and just last year, my father was diagnosed. None of them were overweight, yet they were all afflicted with the disease. I have always been kind of overweight, but I try to be healthy. And 4 years ago, I had the lap band surgery. That was helpful for me, but even then, I didn't know enough to manage my health, and I didn't ask the questions I should have about my condition. My kids just recently had physicals before they started school. They have allergies and asthma. And I've always been good about questioning the doctors and anything that my children have, but I did not do that for myself. If it wasn't a big concern for me, I didn't feel that I needed to ask the question. But when my dad was diagnosed with diabetes, it was an eye-opener. It was scary. With so much diabetes in the family, I am always on the lookout. And as my kids get older and grow up and are more active in sports, I want to be able to keep up with them. This year at my workplace, which is Oakland County, they launched a program to help their employees with diabetes or employees that were looking for information on diabetes. The county's Oak Fit Employee Wellness Program holds classes and events to help us learn to live a healthier lifestyle. When a free 8-week course on my lunch hour for diabetes was offered, I decided to go and sign up. And each week, the course was a different topic, and it helped me learn to manage my health. I'm not a superwoman. It is hard to admit that. I don't have a health coach. I don't jog 3 miles a day. Some days, I eat from stress. But it has been 6 months since the class. I have lost weight. My cholesterol has been lowered, and my A1C count is lower also. It's definitely a work in progress, but I'm constantly making lifestyle changes. Today, I'm much more confident about my health, and when I go to the doctor, I know that I have questions to be asked. I believe a good relationship with your doctor is important, but I also think that there's a lot that one can do on their own to feel better. I'm excited to speak today because I want to tell people 3 things. First, take the time to learn about your health. Second, do something, just one thing to feel better. And third, ask questions until you get answers. You will feel empowered. Thanks for asking me to speak, and I want to tell everybody to care about your care.
Well, that sums it up, doesn't it? By hearing from the patients themselves, care about your care. And Shanda, thank you for being so honest, so authentic, so real. I love having real people tell their stories because we see ourselves in that. That's the challenge that we all have to face today. So let's get some final thoughts. Who wants to go first? Carolyn, you're up.
Sure. So let me just say that was mind-blowing. She was really, really wonderful. And she said 2 things that are really, really important. One is how important it is to ask questions. And the second is, if you don't understand the answers, you got to ask again. Now, the good news is we've got terrific resources on ahrq.gov, which actually gives you a list of sample questions so you can figure out what makes a big difference. And I think the better news that has really been a clear theme of everything we've heard today is that when consumers speak up and get involved at the community level, it changes the conversation. It doesn't get better than that.
Very beautifully stated. Farzad, what are your thoughts?
Thinking about this, what we've learned in our Beacon communities is that you need a few things to really improve quality. One, you need to set a target, like we're going to save 1 million heart attacks and strokes in the next 5 years. That's a clear target. The second thing you need is you need doctors and hospitals to have the tools they need to improve quality. That's happening. The third thing you need is you need payers to recognize that and to reward that. But fourth, and maybe most important, you need patients to be engaged. And we're seeing that happen not only in our Beacon communities, but all over the nation. We're becoming a nation of beacons. Thank you.
Brilliant. Beacons, I like that idea.
Beacon Nation.
Beacon Nation. I'm all for it. Risa, talk to us a little bit about your final thoughts. These are 4 very compelling stories from around the country, really covering the gamut of who's involved in healthcare change.
And as you say that, covering the gamut, it just brings home to me that it's going to take all of us to really improve the quality of care. And we're seeing that. I'm heartened by it. And I'm especially grateful to all of the people out in the audience and to all of the people out nationally that have been working so hard as partners to really improve the quality of care. So I want to thank them. I want to thank everyone here. And thank you, Dr. Oz, for being a part of this.
It was a great honor, Risa. Thank you very much. Thanks to Carolyn, to Farzad for bringing your wisdom to the set today. I want to thank everyone in the many communities around the country who participated. The one thing I feel passionately about is that patients have duties. Understanding those responsibilities is so important for achieving a great healthcare experience. Empowered patients challenge their doctors. They challenge their nurses to deliver the kind of medicine we always dreamed of providing. The kind of medicine where patients realize the awesome power they have in controlling their own quality of care. And they're not afraid to use that power to make their health and their health care so much better. Not just for themselves, but for everybody around them. So get engaged, America, and let's continue this conversation soon. Thank you, and have a great day.
Pleasure.
Very much enjoyable.
Now I know why they watch you every day.
I love the comments. It's good.